Greetings to Madam Mirza. My name is Gaayathri Ayanan and my number matrix is 20202096182, and I would like to do a video recording in order to answer all my final assessment questions for this subject OKU3053. So question number 1, I was asked to give the sports injuries name. So the sports injuries name is concussion, and concussion is a traumatic brain injury that can function affect the function of brain, and it always or mostly caused by bump or blow directly into your head, and this may be caused by some car accidents or even sports injuries like rugby itself. For question number 2, what are the signs of this sports injury is? There are some signs mentally, physically, and also emotionally people could go through during this concussion time. So these are the examples of signs people could have. Maybe they can have a loss of memory or nausea and vomiting. They might have increased sensitivity to light and noise, and they might have problem with taste and smells, and they might forget their memories. They might forget their memories, and confusion could happen, and they might have a problem with balancing, and it might be difficult to focus into something. And then what will happen if the concussion is left untreated? Okay, so untreated concussion may lead to long-term problems, which may lead into chronic headaches, memory problems, vertigo, or even post-concussion syndrome, where these kind of headaches, mood swings, and brain fogs can happen, or they can prolong into a year or a few months after the concussion. One is, how do we assess this sport injury, which is the concussion, through toe taps. Okay, so toe taps is assessment of injury to determine the nature of injury and the extent of injury, whether the athlete can they can continue to play or they should stop their playing. So the first one is talk. T is for talk. So first you talk to the athlete, like what happened. You can shoot a questions like what happened, how is your pain, or how painful is that, can you give rating on your pain out of 10 in the scale of 10. So those are some questions you can shoot when you talk and assess the athlete. And the second one is observe. So as a physical therapist or as a coach, we should observe the injury area and look for the signs of the injury, which could be is the injury bleeding, or is it like swollen, is it like redness or what, or is it turned to blue black thing. So those are the things we can do while observing. And the third is touch. After they talk and observe the injury, we should touch the injury, I mean the affected area, to feel it's warm or to understand how deep is the pain for the patient or the injured athlete. And after that, we should ask them to do the active movement. Okay, the players should be able to move the injury part without assistance or without us helping them. Okay, and the second is passive movement. If let's say the patient can move the injured area actively without assistance, we should ask them, or we should guide them for them to move the injured area in full range of motion or with force applied. And the last one is the skill test, where if none of the above procedure is resulted in injury, then we should ask them to perform a skill test. For example, in a rugby, there is a skill test. There will be a skill, so we should ask them to perform a game test or game skill test to identify if the player should be removed or removed from the game temporarily, or should be given treatment or should be taken care. care of the patient or the injured athlete with a bandage treatment in order to stop the bleeding, then further observation should be going to them. It shall be regarding the bandage, as you can ask them, how is your bandage, is it too tight, or how is your pain now, is it better, is it improving, or we can also ask about is your headache better, or do you still have this noisier thing. So those are the things we can ask for the further observation in order to guide the athlete.
Okay, for question number 2, I'm going to demonstrate on the steps of CPR before, during and after.
Hello, my name is Gaayathri. There's a person here on the floor. I think he's unconscious. The location of the incident is in student lounge, first floor, block 6 in Upsi, Tanjung Malim. Please send help. Yeah, thank you. Okay, first of all, you must look for the danger, make sure the victim is safe and you itself is safe in order to perform a CPR. And second, check for the response. Tap on the shoulder, ask him, hello sir, hello sir. Okay, if there's no response, make sure the airway has no blockage. Tilt the head, lift the chin, okay, and make sure the trachea is clear. After that, you look for breathing, look the chest movement and feel it, or feel here if the person is breathing. And last, you look for the pulse, for the circulation, if there is a pulse, or you can check here. Okay, if there is no pulse, you can perform CPR. Place your hand on the sternum of this person. Do chest compression, 30 compression at the rate of 100 per minute with 2 breathing. Repeat the cycle until this victim got his breathing or pulse, and once he got a pulse, then put the victim into a recovery position, which is okay, this is the recovery position, and make sure the victim recovers.